This Anambra Can Be Better TV. We're here again on the streets of Anambra State to find out what people think about the state of health in Anambra State. I'm Osta Eze and I'm here to carry you along. Stay tuned.
So I've been to Amaku General Hospital, now Chukwuemeka Odumegwu Ojukwu Teaching Hospital. I think they need to improve their accident and emergency, their response time in particular. Sometimes we do bring in students who are very sick. We go to the accident and emergency. It takes them up to 31 hours to attend to some of these students. And sometimes, if these things are actual emergencies, you tend to lose this patient, or at least the problem worsens. So they don't have a lot of people that help them out in the moving patient from one place to another. So the patient relatives will have to carry these patients. So other things are general problems in Anambra State, like maybe in teaching hospital, we don't have machines, MRI, CT, a lot of good investigation. But otherwise, I think what I'm doing can help. What should be done is to provide management, better management, irrespective of whether we have the equipment or not. Provide better management for the hospital, and I think we are good.
I think they actually need to pay more attention is training and retraining of the staff. Having enough facilities without having adequate personnel to man the equipment and all those the ailments, that means people will continue to be traveling out of the country for one ailment which ordinarily could have been solved here in Nigeria by our people, and then employing more people in the health sector. Another area which may be silent, which I want actually, if the government or the people in the health sector can actually look into, is some of these neglected tropical diseases. People think those problems are caused by maybe uncles, nephews, witches and wizards. Take for instance, most of the time, once somebody has leg ulcer, they will tell you they have ulopa. But we know it has now been established that we have a mycobacterium that causes what we call this bruline ulcer. We actually need enlightenment campaign somehow to enlighten people. Once you have problems, go to the health facilities, see the physician, see the health personnel to give you correct advice. Don't ask from people that are as ignorant as you are, because most of the time they will tell you not to take injection. If you take injection, you will die, and you see them in the long run, their legs will just get bad.
Like most people, they don't go for healthcare services, like going for checkups until they're down with one disease or the other. So I'm advising that people should go for checkups regularly to know their health whereabouts, not allowing everything to crash, like especially the fasting blood sugar for diabetes. People should be doing it like once every month to know it, not when it's like too bad, then you start treating yourself on diabetes. Prevention is better than cure. They should employ more hands, like me now as a medical lab scientist. In my unit now, we don't have much scientists there. Like you have one person minding 2 benches or 3 benches. When the person is on leave, it's affecting the whole work.
So you've heard what the people have to say about the state of health in Anambra State. This is Anambra Can Be Better TV. I am Osta Eze, and I hope you enjoyed every bit of it.
I believe the people that have spoken already are speaking from all they know. They do not have wide knowledge or experience of how it happens in other states or other nations where things are working, to compare with what we have here. They don't have it. So for that reason, their comment will be based on what they see. So for me, as far as I am concerned and what I have seen here, the healthcare system is nothing to write home about. It exists skeletally, but nothing is happening. And that is why we are having lots and lots of death coming out of illnesses that could easily be arrested. That is because there's no health care system. If we have a functional medical system, Medicare, I think we should have virtually in all the hospitals health professionals like medical doctors, pharmacists in their numbers. There, once somebody comes in, wants to get medical care, he or she should be able to see a medical doctor who can diagnose what is the problem with the particular person at that particular and make prescription immediately. With the prescription, somebody can now go to the pharmacy or chemist to buy the drug. Thus, examination and prescription. But it is not available at all here. Most general hospitals I've been here, you have maybe one doctor, one nurse, or two nurses who are there maybe once in a week or 1 hour every day in a week, 3 times in a week. I have seen this myself. Maybe they are not there, it's not because they don't want to be there. They are complaining they are not being paid well. They are complaining there are no equipments to use. So most of the time when they spend their 1 hour there, they'll go back to their clinic to spend the rest of the day where they think they have a better equipment and from where they are making some extra money to meet up with their daily need. It is not enough to build a big building and paint it beautiful building, but there's nothing working in it. It's not enough. If I have an opportunity to be the governor of this state, I will work towards having at least, maybe if it's possible, making sure we have medical doctors in the communities, every community. That medical doctor will be encouraged to run a practice within a particular community. Then the government now will be paying for each individual they see, diagnose their disease, and just give prescription. The government will be paying. With that, every Dick, Tom, and Harry in Anambra State will have opportunity of seeing a doctor before taking any medication. It is too important. I will introduce this, and my government will introduce this, because the team I'm coming up with are knowledgeable people who are exposed, that have seen this work outside this nation. It is easy. It is workable. If somebody might be out there and ask me, where will this finance come? The finance is here. It's here. But they are going into private purses. We will manage this finance. Those people that are part of getting these finances will be made to get enough to make them happy. They won't take more than what they need when others are suffering. That's the only place. That's why I know the problem is coming out from. What we have, the money, what we have, the finances are okay.